Hello, I'm Dr. Gale. If you're watching this video, you might be looking for answers on infertility, either for yourself or for someone you know. I'm going to share with you the top 5 things you need to know about infertility and the assisted reproductive technology, ART, options offered by fertility centers. Number 1, infertility is a lot more common than you might think. You may be surprised to know that globally, 1 in 6 couples are affected by infertility. That is 15% of the population. This is referring to couples who are having difficulty getting pregnant. So really, it's even more than that if you consider all people accessing fertility centers, including couples or people needing to access donor eggs and donor sperm, as well as folks who are accessing fertility preservation before chemotherapy, before gender-affirming treatment, or for age-related fertility decline. Number 2, the age of the person with the eggs is the most important factor for the chance of success. We are born with all of the eggs that we're going to have. As time goes on, the number of eggs declines. Additionally, the longer the eggs are in our body, the higher of a chance they have of becoming genetically different from normal, as well as added negative impact on quality of those eggs, which is what influences the chance of pregnancy and the risk of miscarriage. It's for these reasons the chance of success with fertility treatments are optimal before the age of 35. You can see in this graph on screen that it decreases over time for people over 35 years old, with a steeper decline after the age of 40. Age is a very important factor for the chance of success of any fertility treatment. A specialist can further review results with you and your individual chance of success. Number 3, be ready to talk about your overall family building goals. Fertility center patients have different demographic characteristics. Some couples may be experiencing a hard time conceiving together. Other folks may want to start a family on their own or as a couple and need to use donor eggs or donor sperm. Understanding the treatments available to you helps you make informed, knowledgeable choices about your reproductive health alongside your fertility specialist. When meeting with a fertility specialist, the main objective is to help you find the best solution to achieve your overall family building goals. This is why it is very important to reflect on your overall family building goals before you meet with a fertility specialist, so that we can guide you on the best treatment and overall chance of achieving these goals. For example, while there are possibly several treatment options based on your results, such as inseminations or in vitro fertilization, IVF, if you are hoping for more than 1 child, you may consider IVF sooner to try and have extra embryos left over to freeze, or some sort of fertility preservation to optimize your future chance of success as well. Number 4, fertility funding options vary across Canada. For many Canadians, having a baby through fertility treatments is out of reach financially. At present, in most countries, fertility treatments are largely funded out of pocket, often resulting in devastating financial costs. As an example, many provinces in Canada don't have funding for IVF, and a cycle can cost between $12,000 and $20,000 with medications, and surrogacy can cost upwards of $80,000. Also, the majority of Canadian employers provide no fertility benefits at all. The majority that does only cover, on average, up to as little as $2,000 to $3,000. Additionally, only few provinces and territories have funded treatment options, and the wait time to receive government funding where available can be up to 2 years. Before meeting with a specialist, you could inform yourself on whether you live in an area with government funding for fertility testing and treatment, and if you qualify for this funding. The best way to get answers to your questions about the financial investment that may be needed for your situation is by looking up your local fertility clinic and getting an idea of the treatments they offer on their website or by contacting them. Number 5, get support or give support to a loved one the right way. Most are often wondering if they'll get the support they need, or you might be watching this video to understand how to be there for a loved one. It's great that people are having these thoughts. People struggling with infertility do need the support, but the type of support may vary from one person to another. It's important not to pry or say things like, "It's going to be fine," "You'll be okay," or ask if they're trying for pregnancy or when they're going to have a baby. If you have a close family member affected by infertility, simply remind that person or couple that you are here if they ever want to talk, or that you are there for them. Show them support or let them know they can tell you what they really need from you. Unsolicited advice, such as, "Don't worry, just take a vacation and you'll get pregnant," is often not helpful. Tips from people that have not lived in that situation are often not helpful. Studies have shown that psychological support throughout fertility treatments can be very helpful and improve outcomes. We simply need to respect the type of support needed and remember that we are not the ones living in the struggle. You could visit your fertility center's website, which often outlines options for psychological support, or talk to your fertility specialist or family doctor. Fertility specialists can offer compassionate care, understanding, and hope throughout the journey. If you want more information, or if you still have questions or concerns after watching this video, I invite you to reach out to your local fertility specialist or fertility center in order to get more information. Thank you for watching.